I'm Dr. Anthony Cave, and by your request, over 1,300 votes last time I checked, you guys wanted me to talk about something that human beings don't do very well. Topic of gut instincts and why human beings are so bad at trusting their gut instincts in life-threatening situations sometimes, like here in the operating room in medicine. What you need to know about why your instincts are so important to listen to is that if you can advocate for yourself by listening to your instincts, you're less likely to get the quality healthcare that you deserve. If you have ever felt that you have not gotten the healthcare that you should have gotten because you didn't speak up for yourself, because you didn't listen to that voice either in your head or maybe in your heart, in your chest, in your gut, wherever it is for you, let me know in the comments, because I know that there are so many of you that have struggled with this. And unless we can acknowledge it and pinpoint it and specifically talk about what detracts from it, which in the interest of your time, I've listed 4 of the big reasons right here. We're going to talk about them. And specifically, what the concrete, tangible steps are to overcome them. If you can do this, I do believe you will have a better chance at getting the care that you deserve. Hey, Debbie, thank you so much for joining the membership. And I can see your comments so much more easily. And Jocelyn, you are absolutely correct that we are trained out of trusting our instincts, and we also contribute to it ourselves. So let's jump into it with number 1, which is the concept of distraction. Now, if you've ever felt uncomfortable in your own skin, you'll know what I'm talking about. Not all distractions come in the form of that meme that you know from a couple years ago. In their common form today, they tend to center around digital things, right? It's not just being distracted while driving, but more importantly, recognizing that distraction is so ingrained in the human brain and in our nervous system that I don't even call it a defense mechanism as much as a defense reflex. Just like your reflexes, if you're like walking down the street and you trip on the curb or something, your spinal cord reflexes will help catch your fall. That's how strong our defense reflexes are when we're put in uncertain and uncomfortable situations, like before you come into the operating room for surgery, when listening to your instincts could make significant impacts on your health. I compare this to the cheap back door that alcohol and other drugs presents. Distractions are like a cheap back door to avoid being present in the moment. And if you accept that your healthcare is in the long run, like a marathon kind of thing, then you'll recognize that the cheap back door is not going to be the sustainable solution. You deserve better than that. So how do you eliminate the distractions in medical settings specifically? Number 1 is recognizing that gaslighting can completely throw you off your game and can distract you from what you're trying to get answered with your doctor in a particular appointment. So please watch my video when I go through all the different concrete steps to prevent gaslighting, especially if you're someone at risk, like a female or someone of color, someone who doesn't speak English, if you have a chronic pain diagnosis or a disability. These are all individuals that are more likely to be gaslit. Of course, not everyone in those categories is gaslit, but if you're at higher risk or if you've been gaslit before, please make sure that you're checking off those boxes. Those are concrete tips that will help. Now, in addition to preventing gaslighting, the pen and paper note thing, which is, by the way, one of the tips in the gaslighting video, which you should watch, absolutely hits home on what you can do to help prevent being thrown off your game in an encounter. And it's something, not the phone. Do not take notes on your phone, please. Write them down on a pen and paper. Your doctor will better listen to you. Call it implicit bias, call it whatever you want. You will get more attention if you come in with physical paper and a physical pen with your premeditated notes, with your pre-reflected upon concerns. And writing them down while you're waiting is a very good way to prevent the distraction of whipping out your phone and hopping on Instagram or Facebook while waiting for your appointment. So please, while you're in the waiting room, while you're waiting to get your IV put in for a surgery or a procedure, whatever, put the phone away. Trust me on this. Have a pen and paper handy. Be using the valuable minutes leading up to the scary moment to write down what's going through your head so that you have a better chance of sharing that with your doctor and not being distracted in the moment when you're going to be less likely to listen to your instincts because of that distraction. So a way to augment what you're doing on pen and paper is to talk about your appointment or your surgery or your procedure with a friend or a family member. Because when we have lost touch with our instincts in the past, it is so helpful to have a friend or a family member or someone who we trust point out things to us that we are blind to. Remember, the eye is blind to itself, and it's not going to always catch its pitfalls. If you talk with someone before your appointment specifically about what you're hoping to get out of it, if you're brushing the side of your instincts, hopefully your friend will call you out on it before you go through that limited time with your doctor. And number 5, I gotta say, leads right to the next point, which is this concept of fear of failure or fear of being wrong in front of your doctor. This is reason number 2 why patients forget to listen to their instincts or distrust their instincts. I'm looking at the comments here. Mara, I'm so happy that you keep track of these notes. I hope it is being helpful. It sounds like it is. I hope others can also take these notes away. I'm so happy to hear that individuals like Kay Mathis here are also strong advocates for themselves, especially, hopefully, when it matters most, like relevant to your health with your doctor in times when we're most likely to be afraid of failure and being wrong in front of individuals of authority. This is where perfectionism can be your enemy. Why? Why is perfectionism such an easy thing to try to grasp, but inherently going to hold you back? It's like the cheap back door again, because if we're perfect, we have nothing to worry about. So trying to aim for perfectionism and always trying to be right, it almost becomes an addictive drug. Have you felt that way before? Let me know in the comments, because I know many of my patients who come to me verbally tell me just how much that has been a problem. This chase for perfectionism, which is inherently flawed because your instincts are not always right. If your instincts are not always perfect, trying to chase the perfectionism is not going to do you any favors. And I'm going to tell you the big secret here in medicine as well. And that's that for many reasons, I just listed a couple of them here, there are rarely perfect solutions because of the innumerable biases that doctors have to deal with when treating patients like yourself. Right? These are just a handful of them, right? But as you can see, because of all of the confounding variables that happen when you're trying to get your health care, there are few right answers. It's often a mix of multiple answers, maybe better solutions, but not necessarily a perfect solution. In fact, in a recent video, I talked about the number needed to treat the NNT or the number needed to harm. You should watch that video because that really explains the gray area that medicine operates in, where perfectionism does not exist. And trying to be rigid to fit your perfectionism goals, sometimes that addiction to perfectionism, which can just break the backs of my patients. And I'm seeing people here. I mean, Gabby says she can relate to it. I can see many people in the comments here this resonates with them because it's a human instinct to try to be right. We'll talk about that in just a moment. But it's incompatible with long-term success. And recognizing that long-term success is not about being perfect, but about perhaps a growth mindset, perhaps listening and recognizing that instincts are not always right, but if you ignore your instincts, you're more likely to be wrong in the long run. And, speaking of long-term success, I wanted to give a shout out to our recent members here. I just listed a handful of them, but hey, your support hopefully helps you get more of your questions answered on our live streams. For those of you who don't know, when you become a member, I can far more easily see your comments, see your questions, so I can answer them so that you can get more information out of this and make the most of your time here in our live streams. I hope that you're all learning more about how to advocate for yourself, and hey, your support helps me do this for you more often, so thank you all. Number 3 of the reasons why we distrust our instinct is when we fall into, similar to perfectionism, this this concern about there only being one right answer. And I counter that with my patients by reminding them about how silly it would sound if you tried to explain to an alien there only being one path to success or one path to well-being. That simply doesn't mesh with reality. It's not that there's never a right answer, right? But that quest for one right answer in moments when we don't have all the answers is an addiction that the human brain will elusively or try to, grasp this elusive fake truth, if you will. It simply is not real, but the brain will stop at no end to try to find the one right answer. There are often right answers in the plural, but in our quest to try to always be right, my patients often will regress. They'll almost act like children, correlated to how scary the medical situation is that they're coming up to. Like if it's before surgery, I've seen grown AF adults who will act like children in the last couple of minutes. I'm not blaming them. I'm sharing that our brains will go back to their most primitive state in the quest to try to be right. And if you're afraid of being wrong, you're going to be afraid to advocate. And if you're afraid to advocate for yourself in front of your doctor, you're not going to get the care that you deserve. And this leads us to number 4, which I believe is the most powerful and the most important and really the most stigmatized in medicine. That's this concept of blame shifting. A reason why we distrust our instinct is what society tells us in so many ways. One of the comments earlier was talking about how, like, from the moment we're born in modern society, there is this push to, like, not listen to what your inside is telling you. In fact, I see Garden is absolutely, yeah, you're right. You got to listen to the instincts. When society makes us distrust ourselves, such as this push for teamwork. Now, teamwork is not bad, but please recognize that human beings love to be right. All right, I'm dead serious. We relish being right. And if this is not you, let me know in the comments. I'm going to be looking, because human beings are so in love and enamored with being right that we become afraid of being wrong. Teamwork and being in a team allows you to distribute failures over others. Why is this so important? Because when we are distributing responsibility to others, it's like we're giving the key to our well-being to someone else, or maybe to multiple other people. And if we are afraid of being blamed, afraid of being wrong, we give up responsibility because we end up trusting others more than ourselves. If you take nothing away from this video, from our time today, please recognize that the more we trust other people and look for answers in other people, we are in part giving the keys and our responsibility to others. It's not right to listen to other people's instincts in most cases. It's your instincts that matter, and it's your instincts that are often ignored in high-stakes situations like in medicine, when your health is on the line. I showed a whole video recently of severe adverse outcomes that were avoided because a patient spoke up. They weren't afraid of being the squeaky wheel. And it's by trusting the instincts, by not looking towards others, but holding on to the key ourselves, that we can best advocate for ourselves to avoid that cheap back door of trying to distribute blame and failure onto others, but rather us not losing out on the advocating, but looking within ourselves for the solution, not elsewhere. And I hope that this is something that you can all relate to. I want to jump into our live Q&A now for everyone. If you did learn something new, please hit that like button, share what you've learned today with others. Let's start with Asa. Thank you for being a member. I hope I pronounced your name correctly. Learned to trust my instincts 25 years ago after ignoring what I brushed off as hair and face. Wow, retinal detachment. So I'm happy that you were able to advocate, hopefully, for salvaging part of your vision. And I'm not too sure what others may have led you to otherwise believe it was. I'm really happy that you shared your example. Hopefully your outcome was better because you listened to that. Judy, responsibility is a disappearing factor in society. Absolutely. With great responsibility comes great power to turn around. That's from, I think Mark Manson is the author that kind of spun around the Spider-Man quote there. But you're right. When we give up responsibility, we do give up our power, Judy. You're totally right. Elizabeth, I'm happy that this is resonating with you. Cheryl says, my hubby keeps telling me I'm fine, but I know when something's wrong. I can't drive. He won't let me go to the doctor. Well, Cheryl, I'm sorry that you're having this. This isn't the right context for you to give any advice other than to say that you need to advocate for yourself. And if you are in fear of your health, you need to find a professional to work with or reach out to emergency services. But sorry about what you are going through. Art Chem, oh gosh, wow. Well, thank you for the kind comments. And I'm sorry that you had that experience with an arrogant oncologist. I hope that moving forward, you're better equipped to advocate for yourself, especially in times of cancer diagnosis, cancer treatment. Once again, it's when the stakes are high that we have the most to lose by ignoring our instincts. I'm wishing Honey Hush the best for their decision-making on October 11th about the path for your aneurysm in your aorta. That's a very challenging situation to be in, another very high stakes situation. I'm wishing you the best. I hope everyone here is sending you positive energy in that decision making. Jody, you are so welcome. An editor says, if an aorta in the heart is working slow, what do you suggest? A new heart. Well, I don't know what you mean by an aorta in the heart working slow. Sorry, you had to better. Sorry, an editor. I don't know what to. Can't comment on that question. If your instinct is something is wrong, best to check it out. Yeah, if your instinct is that something is wrong, yes. When patients approach high stakes decision making, that's the time to slow everything down. Human instinct in the medical system tries to speed things up for efficiency, for making money, for having the machine keep moving forward. That's inherently at odds with patient safety and with patient well-being. You need to speak up for yourself the closer you get to big decisions. And hey, you're so welcome, honey, for that. Best way to build up listening to your gut, Judy? Well, recognize these things that we went through here. Is it this quest for perfectionism? Is it the fear of failure, the ego that maybe has us step aside and try to melt into a bigger group instead of recognize that we need to sometimes make ourselves vulnerable by speaking up and being that squeaky wheel? Everyone's instincts are separated from their consciousness for different reasons. I'm sharing some of the common reasons I've seen in my patients. James Brown says, I had a symptom arise last week, but instead of calling my oncologist, I called my primary care. Instead, I felt more comfortable talking to him. Is that a good or a bad instinct? James, I'm not in your situation. I would hope that your primary care led you to the right path, and only you will be able to tell in the coming days whether your instinct was right or not, and will hopefully give you the opportunity to recalibrate your instincts as well. Hey, you're so welcome, ArtChem. Garden, I stumbled upon your video at the perfect time, just when I was about to give up on life. I listened to my instincts, could say my... I'm sorry about what you've been going through, Garden. I'm grateful that hopefully something here is resonating, is helping you better advocate for yourself and your family. If there is an emergency, this is not medical advice. You need to reach out to emergency services or other medical professionals, your doctors. But I sincerely hope this helps you better communicate with them. Lucy Lou says, I learned the hard way to speak up. Lucy, it's not only you, it's the hundreds and the thousands and thousands of patients that I've worked with that have similarly echoed exactly what you said. It's why I'm here today. Andrea, you are so welcome. Always be kind. I heard a hospital doctor talk behind my back, called me a pit bull. well, that's simply not going to help foster trust, is it? I'm sorry that you had that experience. I hope it did not lead you to back down from advocating for yourself. I also hope it didn't lead you to losing trust in the healthcare system or other doctors. I want to give a shout out to Debbie here for being a new member of our channel. Thank you so much, Debbie. I hope that you're learning something new to better advocate for yourself. And I kind of agree with Asa here that being a pit bull is not necessarily a bad thing. Let's end with one more question. Well, thank you for all the kind comments, Art Chem, Honey Hush Garden. Hey, CJ, right back to you. Cat, keep on cat. I didn't want to ignore my serious health problems, but no doctor would help. Finally, now my palliative care NP is helping me. I've had scans done. I need to decide about surgeries. Well, Kat, I'm sorry to hear about what you've been going through. I hope that especially if we're talking about palliative care, your gut instinct is probably going to be more valuable than nearly any other input that others can give you. And I hope that your providers are acknowledging and listening and soliciting your input as well in this challenging time. Stephanie, well, you ask a really hard question, but let's end with your question. Why do some doctors dismiss your concerns just because you have bad anxiety? The gaslighting episodes that we've had in the past, I've specifically shared how when doctors don't have a solid test, whether it's a blood test, a radiology exam, or something that they can definitively show that something is wrong, it's at risk of being missed or of being misdiagnosed at the expense of the patient, of course. Things like chronic pain or migraines, bad anxiety, fibromyalgia, conditions which have a reality, but we don't yet have the tools to quantify or don't understand biomedically, maybe because of an overly reductionist view. These are when doctors, myself included, we're out of our comfort zone because we don't have something tangible to go off of to make a plan for you. A doctor who is facile and who knows how to navigate these waters will work with the patient to let the patient, in part, run or direct the ship. Because you're the expert in your body. And if I don't have other signs to demonstrate where to go, I need to take your input into account. But for the doctor who is maybe untrained with this or unfamiliar or feeling vulnerable because of an insecurity, that might be an opportunity for that provider's ego to step in and perhaps sabotage the course of that healing relationship. I'm trying to be very, careful in my wording here. I don't want to say all doctors are like this or all doctors are like that or all patients are like this or like that. But it's where the trust between patient and doctor comes in. Does this answer your question? And for others who have had this experience, I'm curious, Stephanie, is this resonating with why it's in these particular conditions that some doctors are least helpful, while other doctors can be incredibly helpful? This is the divide, if you will, the dynamic range between doctors that you encounter. How much comfort and trust they have with listening to their patient and their patient's instincts. I'm happy that Hannah, this resonates, and I see others here have had the exact same experiences. Yep. And like Andrea is talking about fibromyalgia, I hope that the new doctor that you find is better equipped to listen to you and to give you the care that you deserve. Heidi, as always, thank you so much for your kind comments, and everyone here. If you haven't already, please take a moment to listen to yourself, but the distractions, the quest for perfectionism, the fear of being wrong, and this fear of this blame shifting, try to reflect on it, especially before your next doctor's appointment. If you learn something new, share it with those who you love and care about. And if you could hit that like button, if you learned something new, please share with others and become a member of this channel if you want me to better see your comments here in our live streams. Until next time, remember that you have more power over your health than you've probably ever been told. Oh, I can't see the end button. It's behind the camera.